outreach coordinator, as well as doing some community outreach for North Shore. I was thinking coming down, was that a different name and it changed the name, or they always been North Shore University?
Well, they did have a direct affiliation with Northwestern.
Okay.
And in recent years, that affiliation ceased to exist, and now there's an affiliation with the University of Chicago Pritzker School of Medicine.
Okay, and you've also worked. I always say Northwestern University, but when I talk to Sean Trotter and some other people, they say, you know, you have to let us know that it's the Robert H. Lurie Cancer Center
Of Northwestern University.
Northwestern, so it's a specialized unit
that focuses on cancer.
Right, and my sister, she was up there for some breast cancer work. So you guys, they do research as well as treatment, right?
Absolutely.
Okay, so that whole cancer center, and I was up there recently, they got this new wing or something they built, so it seems like it's really expanding. But the reason why we asked you to come out is talk about the 3rd annual upcoming Prostate Cancer Symposium, which is an educational initiative for patients, spouses, and advocates and healthcare professionals. It's going to be a real good event. So again, I want you to get your pencil and paper handy. It's coming up this Saturday, September 8th, and to keep it real simple, it's going to be at Northwestern University, the Robert H. Lurie Cancer Center, which is within the facility. That you'll see it on the screen in a second while we're talking. And then a little later, for those that haven't, I see you still sitting on the couch, you haven't got the pencil and paper, we're going to give you a few minutes. We're going to put up an 800 number where you can call for even more information. Yeah. And we need you to come out and listen to these experts and become informed. And there's that number. It's 1-888-477-6763. And we're going to put it up a couple more times during the show. But right now I want to go back to Dr. Lombard and talk about, I found out in our first encounter that you're also a prostate cancer survivor. We want to talk a little bit about that, but I'd like for you to start off by talking about the importance of attending an event like this and the importance of becoming aware of getting health checkups.
Right. Well, I would say simply that African Americans suffer more as victim of prostate cancer than any other ethnic group. We have the greatest rates of all kind of disease disparities, including the fact that we tend to die more than any other ethnic group. We tend to have greater incidences of the disease, and we tend to get late-stage diagnosis. We get diagnosed at an earlier age. We have greater recurrences, and we have greater incidence of disease progression, meaning that we have more and higher rates of metastasis than any other ethnic group.
Which means when it does show up in the body, the progression of it is very rapid compared to other groups
and
of people.
There's always a growing number of disparities like that. I found out recently that black men who get treated with late-stage diagnosis tend to have worse outcomes than their white counterparts. They stay in the hospital for longer periods of time. They need more blood transfusions, and they die at a higher rate. So we have this disease in greater proportions than any other ethnic group. That's one reason to come out to the symposium. The other reason is, at this particular symposium and all the ones that preceded it, we have some of the greatest clinicians and experts on subjects that are important to people who need to hear information and messages about prostate cancer, whether it's causation as to the reasons why African Americans tend to have more prostate cancer incidents than other people. And Dr. Isaac Powell is speaking on that subject of causation. Now,
Okay.
he is, in my opinion, and everybody else's, he's the dean of prostate cancer research done by African American clinician and researchers. So he's going to be giving a presentation. Jeffrey Arbog from North Shore is giving a presentation on erectile dysfunction after prostate cancer therapy.
Regardless of what treatment option you take,
Right.
some men.
There's always going to be a side effect of some kind. And Jeffrey, I think, is one of the top experts in the country about the side effects that are consequent to whatever kind of therapy you choose. And then Dr. William Catalona, who's at Northwestern, is probably one of the great experts in the country about the whole issue of the PSA controversy. And he's very proactive about the fact that the PSA test does save lives, contrary to the opinions of some other people. And I think he makes a very convincing case. So we have people at this symposium who are extraordinary in their expertise and being able to give us useful information.
And he's
about prostate.
one of the professors over there.
Absolutely. And he's also a clinician, and I think Dr. Catalona has done more than 6,000 nerve-sparing surgeries during his tenure as a
And one thing that
surgeon and urologist.
one thing that I've always had a challenge with is that this PSA controversy, for the people saying that PSA is not an early indicator, and it just doesn't make sense to me. And I had a discussion with Joe Harrington, and I think Sean Trotter was standing by back in June about this, and I said, well, maybe it hasn't been enough men in the cohort that they conduct the study that had a PSA versus the ones that didn't have a PSA. I just can't imagine. I mean, from the little bit that I know, I would think that, in my case, I know it was an early indicator, but I just can't. And you had mentioned earlier about some people get diagnosed too late, not too late, but it was a term that you used. That can be
Late-stage diagnosis.
Late-stage diagnosis. So that means that the risk factor is higher for survival if it's a late-stage diagnosis, right? Especially in African-American men, possibly.
Absolutely. Late-stage diagnosis could be too late to have an effect.
Right, anything.
Treatment.
Right.
But the PSA controversy, we need to focus on that. And I think you've put your finger on a very important issue, and that is the opinions of men who are survivors, who have experienced PSA tests, have not been solicited. They're left out of this dialogue, so to speak, and I think that's unfortunate, because those of us who've had the experience, we all have strong opinions about the efficacy of the PSA test. Now, the controversy centers around just what is the efficacy of the test. Is it 100% predictive? Is it 100% accurate? Is it infallible? Or is it more like 70% predictive of cancer rather than, say, completely 100%? Now, the man who developed the PSA test, what he pointed out was the problem with the test is that it's not cancer specific. By that he meant that the PSA test does not distinguish which cancer cells will kill you and which ones will not. So,
But I mean, what?
So people tend to think that, the PSA test has that kind of efficacy. That's not what the clinicians and medical practitioners are arguing for. Dr. Catalona's position is that it does save lives, that it is useful, that the efficacy is greater than what the critics say, and that in many cases the study on which the criticism is based are flawed studies. And you can hear specifically what his opinions are if you come to this symposium. And for us, for African Americans especially, we need to know the very nature of that controversy.
Well, let me ask you this now. I don't know if I had flaw in my reading, but is it or is it not true that a high PSA could also be an indicator of BPH or infected prostate?
Yes, I mean, you could have an enlarged prostate. You can have an infection that wouldn't necessarily mean that you have prostate cancer. But
right, and that's my whole point. So the point is that sometimes guys, and they have a high PSA, and then only to find out they had a case of BPH, which is enlarged prostate, and or a prostate infection in the prostate.
Yeah, right, infection could elevate your PSA number.
Right.
But it's only at that point a blood test. So
right.
you can always go back and a month or so later have another PSA blood test.
Right.
If you have a PSA score that continues to evolve, then your urologist may request that you have a biopsy.
Right.
And at that point, the biopsy is something that requires some tissue samples.
Right, and I try not to get into the thing about the grading and the Gleason scores and all that, because it's 2 or 3 things that the urologist, along with the patient, need to take in consideration to try to determine what treatment option. And I know some of the doctors try to make sure that when making that decision, I always like I know a physician, which was my primary care physician. He used to work with women as far as hysterectomy, and he thought it was too many hysterectomies going on. And he always used the analogy, why tear down the house if you can repair the roof? Mm-hmm. And you know, with laser treatment now, those, what do you call them that form in the uterus? The tumors. Now those things can, women don't have to have a total hysterectomy. But some people had opinion, well, if you had a whole prostate removed, then you never have to worry about it reoccurring.
Well, that's not accurate. I founded a group of African American prostate cancer survivors.
The second
opinion society.
Second opinion.
And we try to help and counsel men as to treatment options and so forth. And there's always somebody in our network who has an experience which may be relevant to somebody who's considering one form of treatment or another. But one of the co-founders of the Second Opinion Society is a dear friend of mine who's now a 17-year, maybe 18 years now, African-American prostate cancer survivor. He had his total prostate gland removed, but a year later, his urologist found cancer cells in the bed of the prostate, the place where the prostate gland used to be.
Now, my question, before you go further, my question would be, what stage? And somebody that had early diagnosis, not late stage diagnosis, early stage diagnosis, that had one totally removed. That's just a question that popped in my mind.
I've heard you say over the years about people taking a certain kind of therapy which cured their disease.
Right.
I shy away from using terms like cure because African Americans have such high rates of recurrence. And so we have to be vigilant, diligent to monitor our situation the best way we can in conjunction.
But getting back to what you're saying, now they found a year later cancerous cells in the bed where the prostate.
Yeah.
Okay.
Used to be.
Right.
Okay, but he had a variety of treatments, and he was in a clinical trial that worked out well for him. So for us in SOS, he's our poster boy because he's a 17-year survivor, and he had, in the course of his treatments, 3 different kinds of therapy, and fortunately, it worked out for him. So he's here to tell us now that what his experience is like. We gave a conference at Morehouse Medical Center, and there was a young man in the audience, and I walked up to him during a break, and I said to him, "Well, what are you doing here? Prostate cancer is, quote, an old man's disease, and I know you're 40 or in your early 40s." He said, that's right. He said, "But I just got diagnosed with prostate cancer," and he said, "My PSA was 100. So I called my friend Cortland Cox over, who was a 17-year survivor, and I said, "Tell this young man what your PSA was at the time of your diagnosis." And Cortland's response was 120. So the young man said, "Oh, I feel better already," see, because he was talking to a survivor whose initial PSA was 120. So it all depends on the state of, your diagnosis, your biopsy, and so forth. And fortunately, there are some treatment therapies which worked in Cortland's case. So it's not always just a situation where you can generalize, because when you come down to it, every tumor may be different. And while you might have millions of cells, the configuration of your tumor may be such.
Unlike some other procedures for other disorders or diseases, one thing that I got out of the Pello Institute was saying at their conference, when they said, "What is the best treatment option?" And one of the doctors says the one that best suits
works for you,
that person.
Right.
Because some people may not have the support system on the back end after certain types of procedure to support them in a healthy environment so that they can go through the recovery process.
Right. Well, that's a real issue, because if you get diagnosed with prostate cancer and you have a certain kind of therapy, a lot of those therapies can result in what we call erectile dysfunction.
Oh, you going right.
Right. And so if you want a real profound and cogent discussion of the side effects of treatment therapy, then you want to come to this symposium.
Right.
Because Dr. Jeffrey Albach is probably the one person that you want to listen to.
Now, he's with the North Shore University.
Yeah, he's at North Shore. He's one of our associates and colleagues. But I don't know anybody who's more astute in this whole issue of the sexuality of prostate cancer, especially after you've had some kind of therapy.
And then if you're still married and you have a partner, you need to make sure the right support is in place so the partner can be more compassionate and loving towards the survivor in the recovery process and get a good understanding of. I've even seen some books for prostate cancer survivors talking about intimacy and not so much sex.
Amen.
Which is a good thing. And then I talked to some people that said that their relationship got closer instead of the fear that it was going to drive them apart because he may be impotent or now I don't want to say beyond the blue pill or whatever to be funny, but sometimes in the early recovery process, things just are not working like they were before the procedure, and it takes time.
You should give the lecture. You should give the lecture.
No, I'm not ready for that.
But you're right about everything you said. But this is a real serious issue, because my observation says to me that prostate cancer and the treatment of prostate cancer takes place at a